So I'm approaching you. You have shoulder pain of this shoulder. Again, I'm already thinking the most common thing I'm going to see is in something in the impingement continuum. But I'm not sure yet. You could have anything. So I'm going to come and examine your shoulder. The first thing I'm going to do, and I'm going to do it a little differently for this video, because normally I would stand like right here and do it, which is going to make it hard for anyone to see what's going on. So I'm going to stand awkwardly off to the side. And I'm going to start at the sternoclavicular joint. I'm going to palpate your clavicle. Very easy to find in anybody. And I'm going to go all the way out to the end of it. If you're tender out here, it's a sign that you might have, as your diagnosis, an AC joint problem. This is the shoulder that's bothering you. And I'm looking for side-to-side differences. Always use the control of the unaffected shoulder. So that's the purpose of that exam. Then I'm going to have you bring your arms behind your back. Great. And I'm going to palpate the front of the shoulder here. And the reason that's helpful is the stuff that tends to get impinged against the acromion is protected by the acromion when your arm's to your side. So when your arm rotates, that sore spot comes out to the front, and I can palpate it. So I'm going to compare side to side discomfort with palpation over the anterior shoulder, or what did you say, that the tuberosity, the great tuberosity, either way. And if this one lights up with palpation, that also is a clue to me that this could be a subacromial space problem. Then I'll let your arms come out to the front. I'm going to take your arm, and if it starts to recreate your pain when I get above 90 degrees, that's a sign that this may be impingement. I'll also do it in abduction. And if it starts lighting up your pain above 90 degrees, that's a clue for me that it might be impingement. Then I'm going to check your rotator cuff strength. I'll have you put your elbows at your side. I used to just step in front of people and say, push out against me. And since it's a static test, probably some of those people were doing this, and that's not what we want. So that I've learned the hard way. I say, make your elbows rotate out like that. Good, perfect, and then back in. Now I get a 2-for-1 there. One, I've learned that they know what I want. And two, if they have a stiff glenohumeral joint, this one may go that far right. This is the one we're itching at. This one may only go this way. So that's a big difference in side-to-side external rotation motion. So let's say that that's what you have. Then I know, okay, this isn't likely to be impingement, because the impingers with your elbow at your side have no impingement. They're able to do this. But if you're stiff and limited, you've got something that's restraining the motion of the glenohumeral joint, which can be glenohumeral joint arthritis or adhesive capsulitis. So that finding right there helps me steer away from impingement into one of the other diagnostic sort of buckets. But let's say that that's not the case. You do fine with that. Okay, so both arms rolled off. Well, I'll just start in the starting position again. And now I've learned that you know what I want. I'm going to say, okay, now do that same thing, only push against me. So external rotation against resistance is checking your infraspinatus rotator cuff. Then I'll have you push in toward the middle. Internal rotation is a test. It's not the best. We have belly press and lift off and all that. But for what we're talking about, this is fine. Pressing internal rotation against my resistance checks your subscap. And then the most important test, because it's the muscle that has pathology most often, is the empty can test. I'll have you extend your arms and thumbs down like you're pouring 2 cans on the ground, and then push up toward the ceiling. And that's checking the strength of supraspinatus. So let's say that we did all those tests and you're a little weak and uncomfortable on supraspinatus testing, which is that empty can test. Now I'm really starting to think, okay, you have impingement, and the impingement is likely involving supraspinatus of the rotator cuff muscle group. And I mean, really, that's the exam. And I think that's a short exam with a very high yield, though. And you can add things to it if you want, but really, that'll cover pretty much everything that you're likely to see. If you have a stiff shoulder, we'd need an x-ray to figure out if it's adhesive capsulitis or glenohumeral joint arthritis. That's not a physical exam.